wherever you are. So we'll be recording this session. So in 1 minute, we'll be starting. Yeah. I think we can start now. I can see we have 27 participants and more participants are still joining the call. Yeah, welcome to this GNC satellite event on IM. For the next slide, my colleague Shabib and I will be presenting about the alignment of the HPC. The alignment of IM, information management, with the Humanitarian Programme Cycle. So let me go next. Yeah, for the agenda of this session, we have two main points. The first one is on IM product through the HPC. So first we'll go through the different stage of the HPC and look at examples of product analysis at each stage. Then we'll discuss about the GNC IM operation framework. This will be followed by a period of question and answers, Q&A. And so for the first, before we start, the HPC, someone just wrote the Humanitarian Programme Cycle. So for the background about this session, so we know that information management plays a critical role that can be before, during, and after the emergency. And to have a good and effective coordination, we need effective information management. This is critical to improving the planning, implementation of emergency nutrition response. And we recognize that nutrition coordination teams, they continue to face constraints in fulfilling the information management functions. And this can be in countries where we have IM capacity. We have like an IMO in the country, and it can be in a country where we have an IMO in the country, but with limited capacities. So the objective, let me go next. Yeah, the objective of this session is to brief on the alignment of IM product and following the HPC, and mostly to highlight how support is being provided to countries with limited capacities. And this will be like through the slide, especially like with the second point. And first, we're going to see the Humanitarian Programme Cycle, and just quickly, we are not going to spend much time here. We know like this is composed by 6 elements. And the most important is to know that in order to be effective, we need a good coordination and good information management. And these are the enablers of the HPC. And without coordination and information management, it can be difficult to support during all these stages. So the first one is about the need assessment and analysis. And one thing just to understand here, like this is the basis of the humanitarian needs overview. So at this level, we are able to identify the needs of the affected population and also to come up with the prioritization of different areas and for the coordination team to support about the response. We have two examples of products here. And first, we have the classification of district by severity. So we wanted to share this one, an example from one country, and how we have we can classify different administrative levels and have the classification that can help in the prioritization of the response. And the other map we can see here, this is the number of some cases in need. And this also helps us to have an idea about the population need, and that can help in the humanitarian needs overview process. So the next step is the strategic response planning. And after we identify the needs of the affected population, we know the areas to be prioritized. So this is help us to come up with the strategic response planning. And the HRP, the humanitarian response plan, is built on the needs that were identified during the first step. And at this level, we have this example of analysis, and which is quite comprehensive. And it provides us with the population need, the population targeted. We have the envelope, the funding requirement. We have also the capacity of the partner to respond, how many partners, and the number of projects that will be implemented throughout the year. And this analysis also provides us with the objectives, indicators, and target. And then we can see all detailed information here. It also provides with the map, so we can see, we can visual, and have, the idea about the population need versus population target by governorate. Here, this example from Syria, but this can be applied even to other administrative levels. And we also have the breakdown of the population targeted and taking into consideration the sex and age distribution. So for the next steps, I'll hand over to my colleague Shabib, who can talk about them. Over to you, Shabib. Yeah.
Hi, everyone. Good morning, good afternoon, good evening. Thanks. So as mentioned by my colleague Magna, if you go to next step, please. Next page. So yes, we just try to align this information management with the HPC cycle. So we try to get information and products from countries. So this countries just to inspire another IMOs in other countries how they can use this product against each HPC cycle. For example, now regarding the resource mobilization, as you know, in resource mobilization, we are focusing more in the funding, personnel, supplies. That means when I say personnel, the staff we train, also sometimes services. We have this toolkit, a great toolkit. It's called the capacity mapping. So we know during we collect this information using Excel sheet or Kobo toolbox. We know this information, but we for the product we suggest, if you go to next page, please. Yes, this is the product we just suggest. It is just using Adobe Illustrator, and it can be converted to PowerPoint. So it has the partner, who is the partner, also funding status. So we know the receive, request, and the gap. We know the supplies as the current supplies. Also, we know the training we are provided for CMAM and IOCF, the health worker. Also, we know the services, where is this services? And after that, we can scale up after we reduce this information, we see the gap and scale up. For the second HPC cycle, next please. Yes, I think most of the IMOs are working in this implementation and monitoring example. So we have also this in IM tool kit. It's called the M&E framework. So if you collect this M&E framework, it has target, people in need, target, after that reach. The good things, yes, after discussion with our colleagues from CDC, if you click next, please. Yes, before, yes, we have noticed a lot of countries, they just report against the target, but now they recommended that also we report against people in need, not just target. We have a different example. We have this example, 3 example I will explain now. And also we have a country's example. We just uploaded to GNC IM toolkits. I will share link later. So for example, in this map, we can see, for example, our reach per activity. Also, we have this map show us total reach per admin 3 or admin 4. Also, we can compare the reach against severity ranking. So you can find in the right, in the top right infographic that it is like a point, but this is small image. So you can see, for example, if we reach in the highest severity ranking or not. Also, you can find that we also more specific to have gender and age group. For example, one of the issue you will find when you report, for example, if we say number of reach with MAP treatment and without specific the age and gender, sometimes what I face in the whole of Syria, we reach a lot with children, but less with PLW. So it will be preferred that we disaggregate our product by age and by gender. Also, if there is IDBs and returnees, we can do that. Also, in this one-page dashboard, you can see funding status, your reach against people in need, and against severity ranking. The blue product just, in 2 pages, some people, they write, they prefer to write a narrative or more analysis as a narrative to explain more. So you can find also this 2-page product. And also we have product from Yemen team, they do Power BI. The same things, you just link your data with this Power BI. After that, you will have ready to use product. And also from Sudan, we have also product using the GNC branding. Thank you. If you click next, please. Yes, regarding this operational peer review and evaluation, we don't have that much of product, but my colleague Magnat, this is how to report CCPM. If you go next, please. Yes, Magnat just designed for us this dashboard, but for us, we use it with a country, but for country, they can use it during the year. So they can see this is the core functions. After that, for 2019, 2020, 2021, we can share this product with you, and you just link your data with this product. So this is just our suggest from GNC. Thank you, Magnat. If you go next. Yes, regarding the preparedness, yes, we will present it one product. After that, I will explain the other one. So yes, the idea behind this this product, it is used in a whole of Syria. The crisis and preparedness is for conflict. So you can find this 4 circle, black rectangular. This one explains for us our scenarios. So if the conflict happens in this area or that area or whatever, and we know from this green box, it is where the supply proposition and how many of this supply proposition. Also, you can find our ongoing illustration program or plan or suspend. Also, you can find if this run by mobile or facility or stabilization center. And the background of this map, it is just to tell us, for example, what is the conflict. Sometimes contest area, this is belong to that side and that color belong to the other side. So this is just to inspire you how to have one product. The second product also we have a Power BI, the one just my colleague Faith presented in last session. So yes, this is the two products suggested for this emergency preparedness. If you go next, please. Yes, over to you, Magna.
Thank you, Shabib. So after the first part of our presentation, and now we have this, the second one about the IAM Operation Support Framework. And before we present the framework, so I'll be just quickly presenting it by the priority countries for GNC and for 2021. And so this map, as you can see here, so this is present like the priority 1, priority 2 countries as defined at the GNC level. And this classification was done using different indicators. And one of the indicators is the OCHA Inform Index for Risk Management. And we also have some indicators like data collection, reporting, information sharing. So at the GNC level, we're able to classify country based on the priority 1 and 2. And within priority, we have also different classification based on the capacities of colleagues, IM colleagues in the field. So back to Shabib to explain about this operation framework. Thanks, Shabib.
Yes. Thank you, Magna. Yes, under supervision of our chief Antina, we try to discuss how we can support country. And because of that, we know everyone have a different 3 things. For IM, we are focused in 3 areas: knowledge area, skills area, product area, and after we have this information management competency framework, we come up with some definition how we can have, for example, strong IMs, or we need to strengthen this IM. So you can find that we have priority 1, the green one, and the right one is priority 2. For priority 2, just to let you know, this is non-HRB. Priority 1 is HRB countries, and there is high capacity, medium capacity, low capacity. I will explain how we will define this one. But if we go to the high capacity to see what the overall IM high capacity should be. So in the knowledge area, he's supposed to be, for example, in monitoring and reporting framework, you know, have this knowledge for W matrix, sometimes database. Also, in the humanitarian data, including, for example, the code, how he can bring this common operational data set from HDX website. Also, the indicator registry, how he can deal with humanitarian exchange language. This is just to explain this HXL. We are working with our colleagues from IMAP and GNC online IM task force to have a unique name for all countries to use. For example, maybe in some areas they call it governorate, other area they call it province, other area they call it region. But for us to link all this data, we can say admin one. This is just a small definition to know about HXL. So we are working with our colleagues from IMAP. Also, the humanitarian need services, caseload, target supplies. This is presented by Victoria. Also, he have knowledge about HRB, HNO, and PMR, the periodic monitoring report, and database management. The skills he wants to know, for example, GIS mapping. Maybe some of them ArcGIS, some of them QGIS. The good things for QGIS, open source. Also, he have the skills to deal with Adobe Creative Suite, which is the most important for us is Adobe Illustrator. Also, data management skills in data collecting like MS Excel sheet, Kobo Toolbox, SQL API. Database management skills, for example, Excel, Access, other database like Oracle or SQL Server. Also, he can design interactive products using Power BI or Tableau, and some of them, if they are like programming, R and Python, and it is good for data science also. Now, also, it will be good every IMO to know more about deep. This is the tools using the machine learning. We have training in the IM e-learning, so it is everyone can look at this tool. Also, how to store, publish this using Power BI online service, website management like HR info and GNC website. As you know, the countries they have HR info page and also GNC website. But wherever you put in the HR info for document, it automatically sync with the GNC website and the shared drive. The product we provide, also you can find it in the IM toolkit. It is contact list, bulletin, fact sheet, newsletter, M&A framework, funding analysis, capacity mapping tool, map and dashboard, for example, program dashboard, severity map, gap analysis. If we go to the right one, you will find that list. For example, in priority low capacity, this is we will be focused more with NCC, Nutrition Cluster Coordinator, without IMO. We know we will not give you a headache to just learn ArcGIS or QGIS. If you want, we can support you. But sometimes you want something ready to use. So we can have one-to-one session with you to know more about PowerPoint. But for the high capacity, we can use ArcGIS and QGIS and the same area. So that's mean, and for example, priority 2, it will be more or less, just to give them the basic knowledge for them because they don't have time. If you go next, Magnat. Yes. So how we can support you or which category you will be. So just to give you an example regarding this one, you will find an IMO. He is very strong in Excel and designing math, but he don't know more about nutrition. What is the sphere indicator? How to calculate the beginning of the program for CMAP. So he have this gap. Or you find the opposite, like what I find now here in Ethiopia. You will find some people very good in nutrition. They are nutritionists, but they are working as IM. So they want to complete to work, you know, this is skills like ArcGIS or Power BI. So you will find this type of IMO. So for high capacity, we just, after using the checklist, we categorize them as a high capacity. So we can advise them for IM e-learning. So if they have a gap, for example, they don't know the capacity mapping, we just give them this link for this tool and he will understand it. And we have after that one-to-one call just to fill the gap. For medium capacity, we will advise for them, yes, we will use for them IM checklist. So we go through all these toolkits from 4W, bulletin, dashboard, everything. So we can categorize them. If they have a gap, we can also ask it for them IM e-learning. After that, also we can recommend it, provide monitoring program. So now we are I think open for the 4th round for the mentoring program. For the low capacity, also we will use the IM e-learning, and also we will provide one-to-one call. For monitoring program, it takes 3 to 4 months, but one-to-one call, that means we just find which area we want to strengthen. After that, we just focus in these skills and we strengthen this. Also, we can conduct a webinar. So if we find a multi-NCC nutrition cluster coordinator, they want a briefing in Excel, how to use pivot table, how to do VLOOKUP, this formula, we can support them as a webinar for all of NCC without IMO. Also for, we can bring also priority 2 country, which is non-HRP country. Yes, thank you. Over to you, Magnat.
Thank you, Shabib, for this well-detailed information. And so for the next part will be about discussing how we provide support from GNC level. And I can see in the chat we have some comments already. So let me put these two questions here before we can answer the questions or discuss about the questions in the chat. So the first one is about to know if you have any gap in product analysis that you've identified in your country. And the second one is about, the different areas as mentioned by Shabib, where the GNC team can support. But before we provide some comments on this one, let me just quickly see what in the chat, and I can try to just to comment a little bit. So I see the first one is about if we have any GNC operation presence map, some example. Yes, I can say yes. And even in the IM toolkit, the GNC website, we have the link. So we have different example. And that is the area special monitoring and implementation. We have so many examples from different countries. And this is something if you have any specific thinking, so you can connect with us and then we can support on this one. So let me go to, we have another question regarding the support required for local cluster to implement. Maybe Shabib, you can check this one while I'll be responding to the other question asking about the license to publish on Power BI. I can say yes, we have a free license using Microsoft account. And for this one, there is no limitation in publishing the Power BI. If I can explain more, and so for UNICEF colleagues, so by default, we have the account with the UNICEF email, but this usually prevents us to publish and share something publicly. So what we usually do, so we create an account using Microsoft, and with this one, we can use the Power BI desktop, and it can be easy to publish and easy to be accessible by anyone without having a Power BI license. This is something, if you have any question, we can support on this one. Yep, over to Shabib there is one question here. Yeah.
Yes, regarding this advancing, if I get it well, project at coordination and collaboration at a health zone level. Okay, for health zone level, for us, if you want to design product, it is not that difficult. Yes, we can design it. But the examples we take just it is sensitive for during the information sharing protocol. We don't go level down. For example, to the health facility. But if the information sharing protocol says we can have public product in the health facilities or the health zone, yes, we can design. At the end, we just add one layer in the mapping. Thank you.
Thank you, Shabib. Yeah. I see so many questions keep coming on support on Power BI. Definitely, this is the area we can support, not only having an account, but also to see how we have the online training and if you need further support. And we saw we have different ways how we can support. That can be through the mentoring. It can be through the online training. It can also one-on-one support if there is any specific need, and we can see how we can support on that one. Yeah.
Regarding the question for Bangladesh about build the capacity on IMO, yes, if he can join for a mentoring program, will be good. That we go through building the capacity on IMO. After that, he can build the local information management partner. He can build the capacity for them. Yes.
Shall we maybe correspond the question from Phil? Yeah.
Phil.
any activity relating to archiving and presenting current and historical nutrition survey data. Yeah.
Yes, we have in the IM toolkits the toolkit, for example, nutrition survey data assessment. We have this tool. We collect this information and we mention the date for this one. For this product, not yet have it, but yes, at the end we can design it as Power BI. Yes, it is gap for us. We can look to this product, how we can design maybe think between Power BI and Google Sheet. You just update the data and you get visualization that use. So this is, yes, we have gap on product for historical nutrition survey. Thank you.
And I think for this one, we have a good example with Somalia. So because they use the owner platform, which is linked to Kobo Toolbox to collect data. And for us, we are able to connect with Power BI, and it's easy to update on monthly basis. We just spend time to build the system. And once the system is built, so every month, we just update the analysis with new information. Yeah. This is something we can share the example from Somalia. Yeah. We still have 20 minutes, so if any questions or any comments, so I'll be happy.
Yes, Antenna raises hand. Yes, please.
Yes. Yeah, thanks, Shabib and Magnat, for a very detailed, comprehensive presentation, and thanks also for your work. Just to respond to one question in terms of this was a question raised by Kerati. He was saying, how do we support priority to countries? I think this question is applicable to many of the supporters we provide to countries. We do systematically package our support to countries in terms of their priority. For instance, priority one countries, as you may know, these are countries currently in humanitarian emergency. Depending on the level of emergency, we have L3s or we may have L2s or L1. We do provide them a full package of support, which includes all the help desk supporters, which even goes to an extent of supporting them in terms of deployment and also trainings, direct support in provision of even training workshop is at the moment it's difficult to do face-to-face, but we do, for example, in Myanmar and recently in Niger, trainings which are directly supported by the GNC team. Those kind of trainings is very difficult for us actually in terms of our capacity, human resource available and so on, to do that for priority to countries, which are not currently in emergency, but based on severity index, they are at risk of emergency. They may be in emergency next year, we don't know, but they are. We know that we need to do a lot of preparedness work because these countries are at the verge of emergency. So for those countries, webinars could be a good support mechanism. The e-learning platform, which we talked about earlier on, could be a good source for supporting them because the e-learning platform is available to everyone. And in addition to that, also on case-by-case basis, especially when we get the support of the UNICEF regional offices and also the support from the UNICEF headquarters ERT colleagues, we do also support the specific countries based on the request and also based on the need on the ground. So we package our support depending on the priority level. And for priority to countries, the webinars, the e-learning platform, and also on case-by-case basis, the direct support could be one option. And of course, like anyone else, we have a lot of resources on the website, which includes the IM package and also a number of sample products which the priority to countries can benefit from. Thank you.
Thank you, Anthony. Yeah. I think there is no more comment, and so this presentation will be posted on the GNC website. And on the website we have so many. We have the tools, the example of product, and Shabib just shared the link on the GNC brand book. And within the brand book, we have one chapter on the maps, and provide like different templates that you can apply and use in your country. And we have the operation presence maps, we have the bulletin, we have different analysis that can be used. We also have some analysis with using PowerPoint. So for some colleagues with limited IM capacities, it can be a good example that you can use without having a GIS skills. And if you need support, we are still there, so to provide any support needed. Yeah. There is one question here saying, like, can GNC build one place for product for different countries, and building capacity, changing experience, sharing experience?
Yes.
Yeah. This can.
Yes. Thanks. Thanks, Nasman. Yes. For exchange experience, we have this Skype IM working group. So wherever there is new product, whatever, we just share it in this Skype IM working group. So this is regarding exchange experience. And for countries, yes, any countries, they just design the product using the GNC branding directly. They share it with us, and we post it in our GNC under this link. Once you go, for example, the maps, Power BI, you can find Yemen. If you go to maps using Adobe Illustrator, you will find GNC plus Sudan. So whatever countries, they can share with us, and we can post it. And when we see something during we are to survey in the material response, directly we ask the countries to share with us the AI file, the Adobe Illustrator, and we post it in the GNC website. So we will try to keep it updated. Thank you.
Yeah, good. We'll try to keep it updated and to have as many documents as possible so countries can refer to, and to get some ideas and how to make their own product. Thanks. Yeah.
Thank you.
Yeah, I think that's it. Will be available if you need further discussion and you need any support. So we'll be available to discuss and see how we can provide support. And thank you to all colleagues. I can say have a good day and good afternoon, wherever you are. Thank you so much. Bye-bye. Yeah. Oh, before we leave, we have the poll. Maybe, Shabib, you can launch the poll. Quickly get the feedback and then, yeah. Maybe a few more seconds and then we can end. Yeah. Yep.
Oh,
okay.
Yes. Okay. So I can share now. It is 90%.
I can share that. Yeah. Okay.
Yes.
Good.
Thank you, everyone.
Thank you. Bye-bye. Yeah.
Thank you. I just